morning, everyone. Thank you for coming. This is the Bridges Coalition relaunch of the Yes on My Block campaign. I forgot for a second. We are super excited to have you in the space. This is Nomu Nomu, an artist collective that's been open for about 6 or 7 months. And you can see there's beautiful artwork on the wall. You can take a look whenever you get a chance if you would like to. And behind me is the meat and potatoes of the installation. We have the booths in which people who could or who would use drugs would come and do so that we can make sure that they were safe. I just wanted to take a minute to honor the people that have lost their lives to overdose before we get started. A lot of people in the movement have done so, and to just kind of have a moment to respect and honor them for the work that we do would be great. Thanks. I'm Samantha Kerr. I'm a member of the Bridges Coalition. I also work with BHRC, and I'm the communications manager for that organization. I think it is time to introduce Mayor Brandon Scott, someone that I am incredibly grateful for because not only does he care for the community, but he cares for people who use drugs.
Thank you, and good morning, everyone. Thank you all for joining us today. I want to acknowledge some of the folks that are standing in the line to come behind me today. Our great supporting Baltimore City, even though she's a Baltimore County state senator. Always love to have her in the city. Senator Shelley Hellerman, who is here. Let's give her a round of applause. Our fabulous health commissioner, Dr. Terraza, who is here this morning. I think this may be the first time ever you guys have seen Dr. D and I in public, and we weren't talking about COVID, so hooray for that. Rajani, who is the co-founder of the Bridges Coalition and has the best hair color in the city because it's blue. That is because it's blue and gold, of course. And also William Glenn Miller, co-founder of Be More Power. First, I want to thank the advocates and service providers from the Bridges Coalition who do the important work every day on the ground and who have been integral in building literacy and relationships around this very issue. They've also done the work of bringing us all here together today. I also want to thank the families who have been impacted by overdose, who have also been working through their pain and trauma and doing the work to get us here today. What strikes me about cities across the globe where overdose prevention services are present is the lack of overdoses themselves. Every year, we lose hundreds, most of the time thousands of people to fatal overdoses. And think about the gravity of that and the amount of pain and trauma that each one of these people leaves behind. We must accept that the way we have dealt with people who use drugs has been wrong. And the attempts to address that issue and look at people who are struggling with addiction as inherently criminal were wrong. And when you think about that we lose the amount more than the amount of people that we lose to gun violence, to overdose, and the fact that you don't hear that every night on the nightly news, tells us we have a long way to go in how we think about our neighbors and residents and family members who are struggling with addiction. Because if we lost the amount of people that we lose to overdose in our city to gun violence, we all would be on the streets going crazy because it is an unacceptable number. And growing up in Park Heights, I often tell people that we were taught culturally as a city to look down upon those who use drugs, and really to the point where we were bred to not even see them as human. It wasn't until I was older and away from Baltimore at St. Mary's College that I really realized and understood the realities of substance use, and that this was fundamentally an issue of public health and well-being and not one of criminality. I know many people can share in that same experience, especially if you grew up in Baltimore, where I grew up and when I grew up. On the cultural level and a political level, we have to transform our understanding and be open to new ways of meeting people of where they are. Dehumanizing people and investing in punitive measures in response to this great challenge does not help our community stay healthy, nor does it keep people alive, and we all know it didn't make our communities any safer. For far too long, this war on drugs has forced people who use drugs to face incarceration, suffer social and emotional isolation, and engage in risky behaviors that put their lives and others' lives at risk. These punitive policies have done nothing to curb the overdose crisis in our city and cities across this country. Last year, over 2,500 Marylanders died from an overdose, nearly an 8 people per day, and a 17.1 increase percentage from 2019. Marylanders and Baltimoreans deserve better. They deserve to live. They deserve to be treated with respect. They deserve to get the support that they need. Overdose prevention sites, or OPS as we call them, are safe community spaces that give people who use drugs a place to use and access life-saving interventions, like naloxone and support networks. Over 150 overdose prevention sites exist in 12 countries around the world, and many have been operating for decades. They meet people where they are and are a proven solution to the opioid overdose crisis. Data has shown that overdose fatalities dropped 35% in the area around a single OPS opening within 1 year. Additionally, OPS has a great record of helping participants begin and continue recovery, whatever that means for them, because we have to be very clear that recovery is different from individual to individual. There is no cookie cutter approach. That is also one of the things that we have gotten wrong over the years. Simply put, an overdose prevention site can save lives in Baltimore, and saving lives in Baltimore is my top priority. We have to reimagine the way we think. We have to grow our emotional capacity to understand this issue beyond the fact that this is a criminal behavior. It's not. And at the end of the day, what all of us want is for people to not die from overdose. So we owe it to ourselves, to our city, to our neighbors, to those that we lost to overdose, to try new ways that have been proven, even if they're going to make some folks in our community uncomfortable, even if we're going to have to force them to understand that the ways that we have been working are broken and don't work. We are trying to save lives, and that's why I'm here today and in full support. Thank you.
Thank you so much for those sentiments. Next, I have Health Commissioner Dr. Letitia DeRaza.
Good morning, and thank you, Mayor Scott, for your very progressive leadership. Thank you to the Bridges Coalition for the opportunity to speak today about work that is being done to protect and support the overall health and well-being of our residents. As many here know, reported substance use in the United States spiked 105% between 2010 and 2020, with more than 68,000 deaths due to the opioid overdose in 2020 alone. Here in Baltimore, we lost 1,028 lives to drug and alcohol-related intoxication in 2020. This represents a 165% increase from 2015 to 2020. And while there are many, many efforts by local, state, and federal authorities to end America's opioid crisis, few have been as progressive as the approach we are here to champion today. As your Commissioner of Health, I support the responsible exploration of overdose prevention sites. These innovative facilities provide quality healthcare services such as clean needles, on-site monitoring, and rapid intervention in case of an overdose. The first overdose prevention site was opened in 1986 in Switzerland. Today, there are more than 150 overdose prevention sites operating in more than 60 cities in a dozen different countries, including the US. To date, in more than 30 years of data, there's never been a death attributed to drug usage at an overdose prevention site. New York in 2021 became the first and only jurisdiction in America to open an overdose prevention site. It is my hope that we are poised to be the next city to embrace 3 decades of best practices and more than 100 peer-reviewed studies that have consistently shown the positive outcomes and impacts of overdose prevention sites. Those outcomes include increasing entry into substance use disorder treatment and the delivery of medical services, preventing overdose deaths and safely managing on-site overdoses, providing a safe place for people to find connection and care without a fear of stigma or criminalization, reducing the amount and frequency that clients utilize illicit substances, reducing public drug use, as well as offering syringe exchange and providing and reducing syringe and other drug paraphernalia litter. Also, we've seen a reduction in HIV and hepatitis C risk behavior and an overall savings in costs due to the reduction of disease, overdose deaths, and need for emergency medical services. A Baltimore-focused 2017 study found that $1.8 million annual investment in an overdose prevention site would save the broader healthcare system at least $7.8 million each year by reducing infections such as HIV and hepatitis C, as well as costs associated with ambulatory services and ER visits. For years, we've struggled with this epidemic. Now is the time to embrace the science that has definitively shown that overdose prevention sites are effective, fiscally responsible, and most importantly, they save lives. I'm hopeful that the vision put forth at this event comes to pass one day in the near future. Tens of thousands of lives are at stake, and we shouldn't wait a moment longer to implement public health solutions that are proven to save lives. Thank you.
Thanks for coming out. Next, I have one of the champions of the bill for the legalization of overdose prevention sites in the state of Maryland, Baltimore County Senator Shelley Heddleman.
Good morning, and thank you so much. I just want to commend the mayor and the health commissioner for their bold leadership and thank Bridges and BHRC for constantly championing this very forward-thinking, life-saving policy. It's really important to note that it is the health commissioner from Baltimore City who is here, not the police commissioner, right? This is a public health issue and should be treated as such. For too long, we've treated drug use as a criminal justice issue, and there is a piece of it that is a criminal justice issue, but overwhelmingly, this is a public health issue. I come from Baltimore County. Here I am in Baltimore City, but I came here because drug use and substance abuse is an urban, suburban, and rural problem. It is not just an urban problem. And as someone who represents Baltimore County and who has a district that has all of those elements, that has an urban section, a suburban section, and a very rural section, I am a proud supporter of overdose prevention sites and plan to introduce, should I be reelected, to represent my district, plan to reintroduce legislation to create pilot programs in urban, suburban, and rural parts of Maryland. This is about saving lives. Thousands of people in Maryland have lost their lives. And again, these are people from across the state. This issue knows no bounds. It knows no racial bounds. It knows no economic bounds. It affects everyone. And that's why we need to have an all-in solution to it. This is a piece of the tools that should be available to addressing the issue. If you look at charts of, and Dr. Duriza talked about this, if you look at the charts of the use, it continues to go up. What we have been doing isn't working. And so this is another approach and a very important and safe approach that will save lives. This legislation that I will introduce again with my colleague Jocelyn Pena-Melnick from Prince George's County, the new and incoming chair of the Health and Government Operations Committee in the House. We will take some time to, with all of your help, to educate our colleagues about the importance of what overdose prevention sites are. It's really about saving lives. It's really where it has been done. This is not such an innovative idea. It is in this area, but it's been proven as we have seen in New York City that just opened their first sites in November, to have saved over 350 lives there. And so it is my hope that we can, again, with community support, this is not imposing anything on anyone, it is with community support in urban, suburban, and rural sites throughout this state, that we will take this innovative approach to saving lives. So I thank you, and I look forward to working with many of you during this coming legislative session. Thank you.
I just want to take a minute and say I'm so grateful that everybody's here right now. I know that's probably not what I'm supposed to do, but I'm so grateful to have everybody in this space. Next, I have one of the co-founders of Be More Power, William Miller Jr. And tiny William Miller.
Hello, everyone. Good morning. You keep clapping. There you go. If you're happy, you know what's like. There you go. So I just want to paint a picture of something that will be useful. A nice environment for individuals to go and take a holistic approach. When I mean a holistic approach, not putting a Band-Aid on a sore, but put peroxide on it, or as my grandma would do, alcohol. But you're dealing with everything and not just putting a Band-Aid on it. Things that are needed in Baltimore City, it would cut down on a lot of everything that's happening in Baltimore City. And make Mayor Scott job a little easier. The thing that we're talking about is overdose prevention societies. It saves lives. The fact is proven in different countries. We actually have them here, but they call bandominiums. Ramsey, South Baltimore, Aldway Avenue I grew up at. I lost a friend in my ex-coworker court, Vernon Banks, on McCullough Homes, in the courts. So it's very, very, very personal for me, and a lot of people is doing a lot of work. We have a lot of champions doing this work, but I want to recognize one person. And it's the reason why, like, I couldn't get a babysitter and have my son here, because there's a lot of people in this room, and I don't want to start naming names because I ain't see y'all in a minute, and I don't want nobody to get mad at me and say, why you ain't let me know I was coming to your site. But William Glenn Miller, Sr., started this work along with a lot of other people. And I'm being biased because that's my dad. Communities United. He woke me up one morning and said, son, I need you. And this was work with the post office. Mayor Scott was there, and was a lot of other things going on. It's a lot of individual that's doing the work. But me personally, I would love for it to be collective instead of everyone pulling a different weight. Because, I know somebody tell me, because I know Stacey told me here for a minute, because statistically, we losing a lot of lives in Baltimore City. With the funding that we get, we can do a lot more making people feel good about themselves. And these places will have everything in it that will make them feel comfortable. And when I talk about it again, it's a nice place. And the only knock that people have is, right, it can be the top of the line. It can be a Planet Fitness. They have showers and things in there, restaurants and things like that. Everything adequate for people's needs, that we know about? I know. It's good. All right. Go around. That people need, but the only knock is people that will be using these facilities are people that use drugs. And they're underserved. And they don't feel comfortable going anywhere else. So I think it's my job to make people who are underserved feel comfortable. And I'm going to leave with this because it's the reason why I bought my son. October the 7th, 2020. My dad was at the top of his height. He had everything, just moved in the apartment building. And he overdosed. And that was due to stigma. Being judgmental. The next day, we got a blessing. And I wrestle with this all the time. And the blessing was William Glenn Miller III, who's crying right now, was born. But he would never get a chance to meet his grandfather. His grandfather wouldn't know how his grandson had grown. So let's not lose any more families, because it's about families also, disconnected families. And I'm going to leave y'all with that. Thank you.
And he's gone. Thanks, Will Squared, for coming and sharing with us. It's really important to hear from all people that are in this journey together. And last but never least, one of the co-founders of Bridges and someone who's been working tirelessly for this fight for the last 5+ years, Rajani Goodleveletti.
Hello, good morning. I am Rajani Goodleveletti. I am Director of Mobilization with Baltimore Harm Reduction Coalition. And in 2017, I and a few other passionate harm reductionists and social justice advocates, including William Miller Jr. and William Miller Sr., founded the Bridges Coalition. I'm actually going to invite anybody who considers yourself a Bridges member. You might be wearing a Yes on My Block shirt. You might be wearing a Decriminalized Paraphernalia shirt, to please come up here and stand with me. Bridges is an advocacy coalition aimed at the legal authorization of overdose prevention sites, otherwise known as safer drug consumption spaces or safer injection facilities. Bridges is a group of harm reduction service providers, peer specialists, public health professionals, social justice activists, and mutual aid workers. We are advocates who know that our city, Black communities in particular, have been targeted by the drug war started by Nixon and kept up by all US presidents and Maryland governors since. We are there for people before they use with safer drug use supplies. We are there after with disposal boxes and naloxone. We are not legally allowed to be there in the moment when our neighbors and loved ones need us the most. In an overdose prevention site, we can be there to intervene on an overdose and provide myriad resources for holistic care in our community. When advocating in Annapolis for overdose prevention sites over the past 5 years, we were told by legislators that even though there is over 30 years of evidence showing the public health and public safety benefits of overdose prevention sites, even though we have all of that, stacks of data, they couldn't think of anyone in Baltimore or in Maryland who would want this on their block. At that Senate committee hearing, in turn, we responded with a resounding, yes, I want that on my block, actually, thank you, yeah. Bridges Coalition subsequently started the Yes on My Block campaign, to hear more from policymakers, business leaders, and other community leaders who we knew would support the legal authorization of overdose prevention sites if they knew of their benefits and the potential benefits to save lives of their constituents, neighbors, consumers, loved ones. This past Tuesday, we met over 100 community members here at Nomu Nomu Arts Collective who came to see our installation overdose prevention site behind us. My fellow coalition members and I provided tours of the installment OPS to council members Danielle McCrae, Ryan Dorsey, and Eric Costello. Leadership from the Office of the Public Defender, EMS and fire departments came through, staff of Maryland and Baltimore City Health Departments, Penn North Resource Center, Baltimore Court Watch, Baltimore Crisis Response, and many other residents interested in ending Baltimore's overdose crisis. I had a particular conversation with one visitor, you might know him, former Baltimore City Health Commissioner, Dr. Peter Bielenson. Dr. Bielenson and I discussed the powerful impact of the city's needle exchange program, which opened under his leadership in 1994 here in the city, one of the first in the United States. And he expressed to me his strong support of overdose prevention sites in Baltimore and his strong interest in this city being a pioneer in the state to open the first one. I had another conversation with Jim French, a local businessman who is here today. He is a business owner and provider of affordable housing in Baltimore City. Jim is on the board of the Market Center Community Development Corporation and the Bromo Tower Arts and Entertainment Districts. He visited our installation OPS with a personal interest in the well-being of people who use drugs in the neighborhood of his business. The movement for overdose prevention sites is growing in Baltimore. Join us in saying, yes, I want an OPS on my block. Thank you.
I mean, honestly, I don't really know what to say other than that. Other than thanks everybody for coming. As I said before, I'm incredibly grateful, and I think I can speak for all the members of the Bridges Coalition that we are so incredibly grateful to have the support of Mayor Brandon Scott, Baltimore City Health Commissioner Dr. Letitia Duraza, and Shelley Heddleman, the Baltimore County Senator, and so many other people that are not here and aren't named, but will definitely be coming forward and saying, yes, I want one of these on my block. Thank you all.
Senior? Hold on, your mic isn't on.
There's a whole mic. That's a whole situation.
Thank you. I have a two-part question. One of them is off topic, so maybe afterwards it's...
You can go ahead. You're good.
Can you speak to your coalition you're forming to help address what's happening with the squeegee kids?
So we'll be meeting today. This is work that has already been ongoing long before the tragedy that happened last week. My office, through our Mayor's Office of African Mayoral Engagement, my Deputy Mayor Faith Leaf, Deputy Mayor Ted Carter, have been working around this issue, right? Taking young people who squeegee and getting them jobs, getting the services that they need. And we've been working with great partners like Hotel Revival and others who've been stepping up to do just that. We were hiring young people last week right there as this incident was happening, unfortunately. We're going to continue to do that. We'll be having a conversation today as a part of our broader conversation of our boys and young men of color work that intersects in a deep way, asking more people to come together to try to work for a solution for an issue that they've been trying to solve in Baltimore longer than I've been breathing oxygen.
Thank you, sir. The second question, I think it's kind of towards Dr. Duraja, and it's please, can you respond to the monkeypox concerns and the vaccines that you received from the health department, and how will they be distributed?
Absolutely. So first, I do want to thank the Maryland Department of Health, who it receives the initial allocation. So the CDC always allocates to the state health department first. We've been working closely with them for weeks to identify what appropriate eligibility criteria is. So just as a general data update, there were currently 5 cases in Baltimore and 23 cases in Maryland. So what we've done to date is focus on close contacts of those positive cases. So making sure that those individuals get what we call a vaccination as a form of post-exposure prophylaxis. We'll continue to do that. As we identify cases, we'll focus on those close contacts because vaccinations right now for monkeypox are still a limited resource. Again, we're working with the state to try to get more, but they do remain limited, so the focus is very much on those that have had known contact with a positive case.
Thank you, Mr. Mayor. Thank you, Doc. Appreciate it.
Anybody else? Bueller? All right, thank you.